With me now is Associate Professor of Microbiology and Immunology at the University of Michigan Medical School, Dr. Oveta Fuller. Dr. Fuller, it's good to see you, and what a week that we're dealing with. We see the numbers in Michigan. We're leading the country, 7-day average of 15.5%, and people are saying, what's going on? Can you explain this?
Yes, I wish I could explain this. It's pretty amazing. What I think is happening is that we are in the midst of several things. One, it's springtime. And so there are a lot more people, we're engaging with one another. We're just outside and we're interacting more. It's spring break for our children. Some of our college students have come back from the day or so of spring break. So there's a lot of social engagements, even while we're still getting more people vaccinated, but we're not all vaccinated yet. And then most importantly, in Michigan, we have the B117 variant, which is the Great Britain variant that we know is much more transmissible. So I think if we didn't have any one of those, if we didn't have the variant, we'd be in a much better, we'd see less infections.
You know, and it's baffling for a lot of people who said, gosh, Michigan locked down one of the most of any states in the country, and we did everything right. And so they're talking about this perfect storm. But are we handling it better now, or is it just the restrictions are stopping and people are living the way that they want?
I think we're handling it better. And I think we're all so tired of COVID restricting our lives. It isn't so much the government as it's just that, you know, we had a pop-up clinic, vaccine clinic at our church this past weekend. And it was just so good to see people in person, even though everybody was masked, even though we were distanced. It was so easy to stand by someone and talk. And then you realize, oh, wait a minute, I need to step back because you haven't seen people in a while. So I think we're all caught in this. And we really now have to keep our guard up in an amazing way, because we're so close to being in a position where we can break the back of this pandemic and get it under control, get the positive tests below 5% or even down to 3%.
So that's the number to look for, not what would the herd immunity percentage be? It's the number of positive tests percentage-wise.
Well, this is my thought is yes, the number of positive tests tells you how much virus is circulating in the community in a relative basis based on how many people are coming back positive. So whether you have immunized people or not, that is the ultimate thing that's going to determine how many people get infected, along with things like how many people are vaccinated. But to me, even if we're all vaccinated, we don't really yet know how long it lasts, right? So what if I got vaccinated in December and it lasts 8 months and now I'm into my 9th month? Well, having the herd immunity is less sure than saying the level of infection or level of circulating virus is below 5% or 3% positive tests. So that means there's not much virus out there. So we need to do our mask, or we need to not have gatherings above 10 people, or we need to do this. Oh, but now it's back down to 2%. So, okay, we can get together because there's no circulating virus, or there's little circulating virus. And if somebody is testing positive, we can do the contact tracing, isolation, and control it that way. So that, I think, would help people to realize we can coexist managing coronavirus like we manage influenza or we manage other things. And that's what we want to get to.
Let's talk about the vaccines and your experience. You said at your church with the vaccine clinic. We know that people are now more apt to get the vaccine. Looking across the country, there are 40% of adults in America that have had at least one shot. Right now, over 100 million. What are you seeing in terms of people wanting to get vaccinated and the ease and ability for them to get vaccinated now?
Well, in Michigan, I am really happy to say that the government and both the state as well as the county governments and health departments are making such an effort to move the vaccines into the place where we had the highest COVID cases and to make that access not a barrier.
How about the effectiveness of the vaccine? Are you pleased with what you are seeing so far number-wise?
I am comforted by what I see, and that is that the data going back to CDC from the Be Safe, which everybody is asked to sign up for when they get a vaccine, is showing that the side effects are what was predicted from the clinical trials. Yes, the second time, the second injection brings greater side effects, but that's because the immune system is working. And you're seeing now the antigen that you're responding to. So that means your body is saying, oh, I've seen this before. Let's go into battle. And that's what the side effects are.
I want to look at the next stage of vaccinations because they're looking at the numbers of young people who they believe are spreading COVID right now at this time. And we know that that Pfizer came out and said, we think that we have some really good research and numbers from the clinical trial for the 12 to 15-year-olds. You were very vocal about posting that no for Pfizer initially under the emergency use. What do you think the FDA, CDC, they've learned since then that they should be looking at now if they go to give a green light to Pfizer and Moderna somewhere down the road to start giving it to younger patients?
Yes, well, whenever we look at medicines or vaccines for younger people, they're not little adults, right? So there are things that have to be considered, and that's what actually is happening now with the clinical trials for 16 and below, and then even younger children. And so I think the things that are happening is to realize that right now we have vaccines that are available for 16 and older, if it's Pfizer, and 18 and older with the others. And our young adults and young people need to understand that even though, and now we're seeing more of them getting COVID symptoms, but even if they don't get sick, that they can be infected and move the virus, make more virus, which means there's more opportunity for variants to arise, which could get around the vaccines that we currently have, as well as more opportunity to get it to more people who may actually get sick. So I think if we count on them to do that sort of thing, even as we're looking at moving the vaccine now down to 16 and older, and hopefully by the end of the summer to even younger than 16, that they will come aboard.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.